Okay, so like I said, our topic for today is introductions. And when I talk about an introduction, this may or may not be required.
So like I said,
our topic for today is introductions. So every role play may not require an introduction, right? The criteria relationship building comprises of 4 aspects. First aspect is initiating the interaction appropriately. Now, when we say appropriately, this means that each role play scenario has a unique requirement of how you begin it. So the approach has to be different for each role play scenario. And we are going to discuss different scenarios today from nursing and medicine role play cards. I hope we don't have any physiotherapists or pharmacists in the class. If there
yes, ma'am, I'm physiotherapist.
Okay, Shanza, right? So Shanza,
Yes,
I will include a role play card for you as well, but the examples that we discussed for nursing and medicine are applicable to you as well, right? So the principle remains the same. How we begin the role play will depend on the setting and the background information on the role play card. So even if you're from a different profession, the examples that we share, they're relevant. So I thought we would start off by seeing this blog on the official OET website. This is oet.com. I'm not sure, however, how many of you visited OET, updated its website recently. They moved to a new web address, oet.com. And here you will find many blogs, many preparation blogs on speaking, listening, writing, reading, and grammar. Whenever you have free time, go and read the blogs. They take up about 5 to 10 minutes of your time. You can do this while traveling, during your commute time, or maybe when you're winding up your day. But these are quite useful. So this is the blog that we have on how do I start my role plays. Everyone who's joining, can I please request you to mute yourselves whenever you join? You can raise your hand if you want to say something. If you want to ask something, you can then unmute yourself after I've called you out. Okay, so the way you start your role play is quite important. It gives the assessors a strong impression of how competent you are. And this is also covered, like I said, in the relationship building criteria of your clinical communication skills. So when you're practicing, ask yourself the following questions. Are my opening comments and questions suitable for the setting and my familiarity with the patient? Am I making or am I presenting a professional, polite, and empathetic manner? Am I making the patient or the carer, whoever your interlocutor is, whatever their role is, am I making them feel comfortable and respected? You're likely to need to start each role play in a different way to suit the situation. And I keep saying this again and again in different ways, because one of the common mistakes that I notice when students practice a role play with me is that you try to use a formulaic expression, something that they've memorized, and it's a very generic sentence, something like, hi, I'm nurse this, how can I help you today? This is an example of a very general statement that you try to fit, but then this may or may not be relevant for the context that you have. So make sure you read the card carefully and learn to adapt. By adapt, we mean change. That you learn to make even if you have a set of phrases or vocabulary with you that you like to use, that's fine. All you need to do is you need to personalize that phrase. For example, how can I help you today? If you had to personalize it to a role play card where you are working in the emergency room and a patient looks, the role play card suggests that you are talking to a patient who's visibly in some discomfort. So rather than just saying, hi, I'm Nurse Gurleen, how can I help you? You can personalize this introduction. You can say, hi, I'm Nurse Gurleen. I see that you are in some discomfort. What can I do for you today? Or how may I help you today? At least now when you're using this sentence, how can I help you? You've personalized it to context. You've picked up some information from the role play card, from the background information. Then you have used the phrase that you would have wanted to use. So that ways, we will always suggest that whatever you want to use in the role play card, whether it's a phrase or some word, make sure it fits into the context that you have. So there are two things that your initiation will cover. When you initiate the role play, there are two things that are covered there. One, whether you should introduce yourself. Number two, whether you need to ask the patient's name during the role play, or you can assume the name during the preparation time. So let's take these one by one. Let's first see whether you need to introduce yourself or not. Most role play cards make it clear from the background information when you've already met the patient before, or that you've just examined or treated before starting the conversation. It helps to know this so you can open the conversation appropriately. If this is not explicitly stated, you can assume that this is the first meeting and start with the introductions. Now, what do we mean by this? Sometimes in your role play cards, it will be mentioned that you have just finished examining the patient, or that this is a follow-up visit, or you are making a home visit. So in those cases, you obviously have met the patient before, right? In a follow-up, you would have met the patient before. If it's a home visit, you have the information, an appointment must have been scheduled. So in that case, it's likely to assume that you've met the patient before, or that you know at least who the patient is. In that case, you know who the patient is. And if you've examined also, obviously, if this consultation has gotten to that stage where you've examined the patient, the introductions are likely to have happened prior to the examination. So if this is mentioned in the role play card in the background information, then you don't need to introduce yourself. For example, I would want you to read right, let me show you another context. Is the role play card visible?
No, ma'am.
No?
Ma'am.
No, ma'am.
No, ma'am.
Now is it visible?
Yes, ma'am.
Yes,
So this is for doctors, but even nurses and even Shanza, you can read this. We are just trying to understand whether or not an introduction is needed in this case. Okay, and this can happen in a nurse's role play card also. This could be the case for a physiotherapist's role play card also. So see, what is the setting here? It's a clinic. And now let's read the background information. Don't read the tasks. I just want you to read the background information. So this 42-year-old has been experiencing his or her right eye twitching for several minutes throughout the day over the past month. This has never happened to the patient before, and he or she is very concerned. You have examined the patient. You have examined. Which tense is this?
Ma'am.
Past.
Present perfect.
Simple past.
Present perfect.
Present perfect. Yes. So has this action happened? You have examined. Are you going to examine, or the examination is complete?
Examination is
Completed.
Complete, ma'am.
Very good.
I have assignment.
Yeah. So the examination is complete. You've examined the patient and diagnosed eyelid myokymia. Is that correct?
Myokymia.
Yes, ma'am. Yes, ma'am.
Myokymia,
Yes,
okay,
ma'am.
which is benign self-limiting fascicular contractions of this muscle, which is a medical term. So now, based on this, let me show you a few examples of, and these are from real candidate performances. So this is one way a candidate has started this role play by saying, yes, good morning. Then the patient says, good morning, how are you? Then the doctor says, what brings you here? I'm Dr. Imran. Then the patient answers the question. Now, according to you, is this suitable or not? The introduction.
No, ma'am.
No,
Because
ma'am.
it's
Not
in the middle of the
suitable.
conversation,
No,
ma'am.
One by one, it would help if one person can speak at a time. Do you want to raise your hands if you want to answer? Okay, Madhu, please tell me.
Ma'am, because it's the middle of the conversation, ma'am.
Very
Because
good.
we have recently examined the patient, ma'am. So we need not to
Exactly.
introduce, ma'am.
And this is real examiner comment. Now, I have taken the liberty of sharing some examiner comments with you. And in the classes that we have after this also, I will pick up real candidate examples and share the examiner comments with you. So you understand how marking is done, how you are graded on your performance. So see, on this introduction, what do the examiner comments? The candidate greets the patient and initiates the interaction inappropriately. Okay, so this is a part of relationship building criteria. Obviously, there are 4 things in relationship building also. So this is not the sole criteria on which 1 mark is given, but you are being judged on this, how you initiate the interaction. Let's see the second example. Now look at this introduction. Patient says, hello. Then the doctor starts by saying, I'm your doctor. My name is so-and-so. I heard about your eye twitching. For that, I need to know more information from you, please. Is this suitable?
No.
No, ma'am.
It's not
Ma'am.
suitable.
No,
Right?
ma'am.
Same reason, because the examination has already happened. So the introduction would have taken place before the examination. And similarly, you can see the examiner comments here. The candidate introduces himself, which was unnecessary. Now, the candidate has scored a 2 in relationship building, which is due to other factors. I mean, when we discuss empathy and non-judgmental attitude and other aspects of relationship building, then you will realize that even if you make a mistake, sometimes you can make up for that mistake in other ways, which we will come to later. But starting the role play appropriately is a very good way to get good marks in relationship criteria, right? So this is why we're having this class today. So this is, and let's go back to the blog for now. We'll come back to the activities again later. But the purpose of showing you these comments was that this is something that the assessors take note of. All right, let's now see these 3 scenarios. Read these examples of background information from 3 different role play cards. And you need to just answer whether or not you need to introduce yourself in this scenario. Let's see the first one. This is for doctors. A parent presents with his or her 5-year-old son, Matthew, as a follow-up after an emergency consultation 2 days ago when Matthew was newly diagnosed with asthma. Then Matthew experienced a severe bout of coughing, breathing difficulty, and wheezing on the background of a cold and low-grade fever. In this case, when you start the role play, do you need to introduce yourself?
No, ma'am.
No, ma'am.
No, ma'am. Ma'am,
Okay.
yes, ma'am. Yes,
Okay.
ma'am. Yes
How
or
many-
no, ma'am? Both. Both, ma'am. Yes or no.
Right. Who said yes or no?
Ma'am, it's optional.
Ma'am, me, ma'am.
It would help if you can just raise your hands.
I have raised, ma'am.
Yeah. Okay. Okay, Madhu, why do you say it's both yes or no? Why do you feel it's a yes?
Ma'am, yes, it's maybe chances, ma'am, that we have attended the patient yesterday when we diagnosed the patient, and it may be someone else also attended the patient, and I am available now, ma'am. That's why yes or no, ma'am.
Okay, good point. That's a good point. I would like to hear someone else's take also. Yes, Amanpreet?
Ma'am, from my side, all same answer. Maybe yesterday somebody else on duty and now he had met with another doctor.
Okay, let's discuss both scenarios. Let's assume that you have not attended the patient yesterday, somebody else did, but now you are there for the follow-up. Then how would you start the role play?
Ma'am, by introducing ourselves and confirming the name of the patient.
Okay, and what would you say afterwards?
Ma'am, background information.
After, ma'am, we take the help of some of the background information about the that you have been your child has been diagnosed with asthma, and
Go on. Okay, you've muted yourself. Yes, Krish, do you want to try?
Yes, Miss. So we can introduce ourselves and then tell the mom that as you are aware that your child was diagnosed with asthma, so I'm here to help you more about himself, and I can see his notes, and he has severe coughing, breathing, and wheezing as well. Is it okay, ma'am?
Yeah, it's fine. So like you all said, both the scenarios can be appropriate. See, first is where you assume that you were the person who attended Matthew and his parents in the previous consultation also. In that case, you don't introduce yourself. In that case, use a sentence that conveys this to the examiner when they hear. So something like,
good to see you again.
yeah, let me share an example and then I'll hear yours. Hello, Maria. It's good to see you again. How is Matthew doing now? So when you say, how is Matthew doing now? Or it's good to see you again, these examples, they convey to the examiner that you are not introducing yourself because you've met the parent before, that you were there in the previous visit. This is based on that assumption. Second assumption or second scenario can be where you assume that you are attending the parents for the first time, someone else attended to them in the previous visit. In that case, use the phrases appropriately, accordingly. So in that case, you could say, hello, I am Nurse Madhu. If I'm not wrong, you are Matthew's mother, right? How may I address you? And then you can again, after they tell you what you can call them, then you can say, okay, so I have the case notes here, and I see that Matthew was admitted 2 days ago with problems in breathing. How has he been doing since then? This is another way. And both of these are appropriate. Is that okay? Any questions about this? Yes, Aman, do you want to say something? Aman, is there something that you want to say? Your hands raised?
No, ma'am.
Okay. So these are the two scenarios that we discussed. According to me also, both are appropriate. Then let's see the second one. This is for a pharmacist, and the setting is a local pharmacy. Your client is 35 years old, quit smoking recently. Since then, he or she has put on weight. He or she is interested in some medication for quick weight loss. In this case, would you need to introduce yourself?
Yes, ma'am.
Yes, yes, of course, because there is no indication.
Yes,
Yeah,
ma'am.
there is no.
Yes, ma'am.
Yes, yes, I agree with all of you. There is no indication in the background that you have met the patient before, or that that this is not the beginning of a consultation, or that you've met the patient before. Then let's see the third one. You're making a home visit to a patient who's suffering from COPD and requires continuous oxygen. Mobility is now a problem. The patient's spouse has been caring for him or her at home for 2 years, but has recently returned to work. You have just finished an assessment of the patient's needs and are discussing full-time care options with his or her spouse. Do you need to introduce yourself when you start this?
No, ma'am.
Middle of the conversation, ma'am.
Very good. Yes, because the role
Examination is already done, ma'am. Assessment.
yes,
Observation.
very good. You have just finished an assessment means that introductions would have happened before the assessment was done from your side.
Yes.
Good, good. I'm glad that you're getting the hang of it. So now this was about whether or not you need to introduce yourself. Now let's come to what name should you be using for the patient or the relative or carer. You might be unsure about how to address the patient or the carer. You need to ask yourself, have I met this person before? Or is the situation urgent or not? If it's clear from the role play card that you've met the patient before, then using one of the 3 options below will demonstrate to the assessor that you've understood your relationship with the patient. So let's come back to this example here. In this, the introductions would have happened before the assessment. In this case, when you start the role play, would you ask the patient's or the spouse's name?
No, ma'am.
No, you wouldn't, right? So in this kind of role play, you have 3 choices. Either you can use the interlocutor's name, which they will tell you when you meet them in the speaking test room, or during the preparation time, you can ask the interlocutor what name they would like you to use, or you can choose a name for the patient and use it at the start of the role play. The interlocutor will accept this and respond to it. So you have 3 choices. 1, you can use the interlocutor's name as it is. 2, before the role play starts, during the 3 minutes preparation time, you can ask the interlocutor, what name can I use for you? And whatever name they give you, use that to start. 3rd, you can assume a name yourself, whatever name you prefer. I know students at Khaira Education prefer the name Jenny. I've heard many students saying, hello, Jenny. So this has become a very popular choice. So you can assume a name and then start that role play with that name. And all of these are equally acceptable and appropriate. This is for those cases when it's clear that you've either met the patient before or that the role play is starting after an examination or assessment. In case it's the first meeting, if you have a role play which is your first conversation with a patient, then briefly introducing yourself and checking the patient's name is appropriate as a part of setting up rapport. An example has been shared here. Hello, my name is Amira. I'm one of the nurses on duty here. It's good to meet you. Can I call you Jackie? Otherwise, you can even ask the patient, how may I address you? What do you prefer that I call you? What is your name? Okay, so either in this example, they've assumed a name, or I think it would be more appropriate if you can ask yourself that, what's your name? If the patient shares their full name with you, then you can ask, what do you prefer that I call you? Or how may I address you? If they share their first name with you, then you can start off with that name itself. Now, an exception to this rule, asking, how may I address you? Or what do you prefer to be called? The only exception to this would be an emergency situation. The urgency of situation may also determine how you introduce yourself, your speed, your tone of voice, and your choice of phrasing. Note the difference in how the candidate opens a conversation in these 2 different scenarios. The first one is an emergency setting. So you're speaking to the parent of a 3-year-old girl admitted an hour ago with breathing difficulties. So this situation is likely to have caused anxiety for the patients. In this scenario, you should speak more directly and quickly and get to the point in your opening sentences. This demonstrates to the assessors that you are aware that long introductions in this case will not be appropriate to the scenario. So an example here is, hello, Steph, my name is Greta. I've come to give you an update about your daughter. Or even if you don't want to assume the parent's name, you could say, hello, I'm Greta. What's your name? Okay, Steph, I'm here to give you an update about your daughter. Right? So here we are not getting into that courtesy of how may I address you? What do you prefer that I call you? Or we are not even using long sentences that I am the nurse looking after your daughter. So no long introductions or no long opening sentences. In emergency situations, be very direct, come to the point very quickly. Now compare this to a non-urgent setting where you've not met the patient before. You're speaking to a patient who has an appointment with you to have stitches on their hand removed. Hi, Dawn, my name's Rohin. I'm the nurse taking care of you today. I understand you've recently had surgery on your hand and the stitches are ready to be removed. Is that right? Or an alternate to this could be, hi, Dawn. Sorry. Hi, my name is Rohin. What's your name? Or am I right in thinking that your name is Dawn if you want to assume the name? Because if somebody has an appointment, you would obviously have their first and last name, right? So you can say that, hi, I'm Rohin. I'm going to be the nurse taking care of you today. Could you please confirm your first and last name? After the patient confirms, you can say, all right, what do you prefer that I call you? Or how may I address you today? Then you can start using the first name after they've shared it with you. Okay, Dawn, so I understand that you had a surgery in your hand recently and today you're here for getting the stitches removed. Is that right? Or are you ready? And that is another way. So see, the reason these two examples I mentioned here is for you to notice the difference. The first one was an urgent setting where biomedical attention takes precedence, right? So there you don't have time for lengthy or elaborate opening sentences and introductions. You've come to the point very quickly in the second sentence itself. In a non-urgent setting, it is better, it is preferable that you are more courteous and respectful, and then we can get into this formality. Any questions about this?
No, ma'am.
No, ma'am.
No, ma'am.
Okay, then very quickly, one more question before we move on to activities. Is it too informal if you use the first name? Normally we ask, right? We believe that it is respectful towards the patient that we take their consent or permission before we address them by the first name. Now, what OET suggests is that in Western healthcare settings, it is now accepted that professionals can use the patient's first name when speaking to them. This is in keeping with patient-centered care approaches, which value a friendly yet professional tone for conversations. You can use the patient's first name in the speaking role play, regardless of the age of the patient. If you wish to show appropriate respect for an older person, you could ask if they mind you calling them by their first name. For example, do you mind if I call you John? Or what do you prefer that I call you? Is it all right if I address you by your first name, John? So what OET is suggesting is that if it's an older person, you can get into the courtesy of asking whether it's appropriate or whether they prefer that you use their first name. In all of the cases, even if you don't check with them and you simply use their first name, it is appropriate. Okay, so I think something that you should keep in mind is see the age of the patient when you get your role play card. If it's an elderly patient, then don't forget to check. Don't forget to take their consent before you address them by the first name. In other cases, it's all right if you can use the first name even without checking with them. The speed and the tone of your voice can also be adjusted when speaking with an elderly patient. This will show your attention to relationship building. What do you think the speed and the tone should be like? How will it need to be adjusted when you're speaking to an elderly patient? Raise your hand if you'd like to answer. Yes, Divya? Go ahead, Divya, please answer.
Yes, ma'am.
You wanted to answer. How do you think the tone and the pace will need to be adjusted when you're speaking to an elderly patient or an older patient?
Or don't.
Would anyone else like to try? What, Dr. Navdeep, you want to try?
Ma'am, soft and more and
I'm sorry, I think due to the network, we're not able to hear you. Akashdeep, go ahead.
Ma'am, tone should be like polite and normal, not use a high tone or a very small, low tone. That.
And what about the speed of speaking? Should you be
We
speaking
have to-
quicker than
Ma'am, speed
usual?
should be normal.
It should be slower than usual. When you're speaking to an older patient,
Yes, ma'am.
you speak slower than usual. Okay. And I think I would recommend it for children also. If you, although I doubt in the OET roleplay cards, you would be speaking to a child directly. You normally speak to a patient. But when it comes to children and elderly patients, I think your speed should be adjusted in a way that it's slower than usual. Number two, when it comes to the tone of your voice, it should be very calm. So normally, we sound very high-pitched and enthusiastic. I think when it comes to an elderly patient, it would be a good idea to perhaps adjust your tone, which sounds very calm, very equanimous, very calm and balanced. Suman, do you want to say something?
sympathetic.
Yes, Suman.
Ma'am, we have to be politely calm, sympathetic toward the elderly person.
Yes, I think that's true for all cases, but especially when it comes to older patients, it would be a good idea to be very, very calm when you speak to them. Like lower your pitch, intentionally lower your pitch and speak slower than usual. And finally, if you choose to ask the interlocutor for their name either before or during the role play, use the name that they give you. While it might be a little rude in your culture to use the patient's first name only without adding a title, in Western scenarios, it would be considered rude to ask someone their name and then change what they have said by adding a title. What do you mean by a title? Do you know what title refers to here? Mr. or Miss?
Miss.
Yeah.
Yes, ma'am.
So if the interlocutor says that call me Mr. So-and-so, then only use the title. Or if the interlocutor says I am Miss So-and-so, then use that. Don't add a title on your own. Use the name exactly as they give you. That's what this means. Any questions about what we've discussed?
No, ma'am.
Oh, lovely. Now it's time for you to do the work. Can you see the role play card on your screen?
Yes, ma'am.
Yes, ma'am.
Lovely. Now this is for nurses, but of course, doctors and Shanza, you can also respond. I would like you to read just the setting and the background information and the first task. I'm allowing you to read the first task. After that, I want you to just raise your hand and we'll practice introductions. I'm giving you 1 minute to read this. If you have a notebook and a pen with you, note down how will you initiate the interaction. All right, shall we discuss?
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am.
Okay, who would like to give this a try? Yes, Dr. Navdeep.
Am I thinking Martha?
Dr. Navdeep, I'm so sorry. I think it's the network at your end, which is disrupting your audio feed. So it's a little clunky. I'm sorry, I'm going to move on to the next participant. Madhu, would you like to try?
Yes, ma'am.
Hmm.
Good evening, Martha.
Good evening.
I'm Madhu Kangra, the attendee today. You look quite uncomfortable. Could you please tell me what's bothering you?
Okay. So you assumed that my name is Martha, right? Akash, would you like to try?
Yes, ma'am.
Go on.
Good morning. My name is Akashdeep Kaur. I am the one of the registered nurse in this facility. I am seeing you are looking very uncomfortable. What is bothering you?
Okay. Akashdeep, you haven't checked my name. You
Yes,
can assume a
ma'am.
name like Madhu did. You can assume a name, or you can say,
Okay, ma'am.
"Hi, is this Martha? Martha, I'm Nurse Akashdeep. I see that you're in some discomfort. Please tell me what's bothering you."
Okay, ma'am.
Okay, Raman.
Yes, ma'am. Good evening.
Good evening.
My name is Raman. I'm one of the registered nurse over here. Well, Mary, I can see that you seems very uncomfortable. May I know the reason behind it?
Okay. Now, all of you, I think you said I'm one of the registered nurses or I'm the registered nurse. Why don't we personalize it to the setting? Why don't we say that, "Hi, I am Nurse Amarpreet in this emergency room," or I'm one of the registered nurses on duty in the ER today. Something like that. Personalize your introduction to the setting, to the context. That is much better. All right, look at these two. Although I think we've covered the rationale behind this, but which introduction is more appropriate? Or which
Second one.
Second one is more appropriate? Why?
Ma'am, because in this conversation, we assume the name of the patient.
Okay, anyone else?
Ma'am, it's little indirect and the patient is in discomfort, so it's good to ask the patient in a
Okay,
discomfort.
how many of you say first one is appropriate? With a show of hands.
First one.
Raise your hands if
First
you think
one,
the
ma'am.
first one is appropriate.
First.
Majority thinks first one is appropriate. Okay. And would one person, Bharti, would you like to answer why first one is appropriate?
Ma'am, because this is an emergency setting and we don't have much time that we call about the patient. How may I address you?
Fantastic. Lovely. Yes. So it's an emergency room. So it's an urgent setting. And like we discussed, what was written on the OET blog, in an urgent setting, don't waste time in elaborate introductions. So this is very direct, like, "Hi, I'm Nurse Kurleen. What's your name?" "Right, John, I see that you're in some discomfort. Please tell me, how can I help you?" This is more direct and more appropriate for an urgent setting. If it were a non-urgent setting, then the second one would be better.
Yes, ma'am.
All right. Now we have two scenarios. We will do the first one first, then I'll give you time to read the second one, and then we'll discuss. I'm giving you 30 seconds to read the setting and the background information on the left-hand side column. And the question is, do you need to introduce yourself in this setting?
Yes, ma'am.
Yes? How many of you say yes with a show of hands?
Ma'am, yes or no, ma'am, both. We can assume that we have.
Ma'am, both, ma'am.
Both. Your introduction. You can see the task, first task.
Yes, ma'am.
Yes, ma'am. I think
We
it
have
is
to introduce
important.
them.
Yes,
We
ma'am.
have to
Yes,
introduce
ma'am.
them.
Yes,
Ma'am, we have to
Yes, ma'am.
introduce.
Lovely. So much noise, I can't hear anything. Can you now please raise your hands? Okay, Suman, tell me please.
Yes, ma'am. Ma'am, I think it is important in the home visit to introduce ourselves and confirm the name of the patient.
Okay, see, right. I'll come to this. Ritu, what do you think?
Ma'am, yes, it's important to introduce ourselves because it's not compulsory that the patient nurse similar that was attending in the hospital same nurse will going to visit here. That's why.
Yeah, very good.
Yes, ma'am.
Let me see if Shatabdi agrees with you. Shatabdi, what do you think?
Yes, ma'am, that's correct because
correct.
it wouldn't be the same nurse.
Yeah, and Kajal, just like it's at Jenny's house, am I talking with Jenny? Okay, so see, like we discussed, when you start the role play, there are two things: whether you introduce yourself and then how you address the patient. Let's first only discuss whether or not your introduction is necessary. Do you need to say, I am nurse so and so? So in the first scenario, yes, I think an introduction is required. Like Ritu said, you are not sure who attended the patient when that patient was admitted in the hospital. You know that the patient has now been discharged and this is a follow-up visit to the patient's house to check up on his progress. And if you see the first task, you know this is the beginning of the conversation. Inquire about the patient's progress. This is the first task, right? So you know that you're going to start the role play from the very beginning of the consultation. So the visit is yet to commence. You are going to start the beginning of the consultation. So in this case, yes, your introduction would be required. So you will say, hello, I'm nurse so-and-so. I'm visiting you from the hospital today to check up on your progress. Now coming to the patient's name. See, when you have the patient details with you, do you really think you need to ask the patient's name? You would already have.
We can confirm.
You can confirm.
We can assume.
Yes,
But ma'am, we can confirm.
Confirmation is
We can
Ma'am,
assume.
confirm.
Okay, how many of you say you can assume? Please raise your hands. And we've got 73 participants. There are only 15-20 people who are participating in this poll. Can I see equal participation from everyone, please? Do you think it would be suitable to assume the name in this case, or would you need to check the patient's name or confirm the patient's name?
Ma'am, confirm.
Confirm, ma'am. Right now. Just raise your hand if you think you can assume the patient's name in this role play. Okay, so some of you think, not all of you, but some of you think you can assume. What about others? Do you think you want to check the patient's name, confirm? Can you give me a sample sentence, an example of how you will confirm? Ruchi?
Ma'am, am I talking to Maria?
Am I talking to?
Maria?
Okay, so you can assume the patient's name, or you can ask the interlocutor and then say something like this, that I am nurse Ruchi. I'm here from the hospital to check up on your progress. Am I speaking to Maria? Is that what you're saying?
Yes, ma'am.
Okay. Any other example?
Ma'am, I am here to see Miss Martha. Is this Miss Martha's house?
Lovely. Okay, lovely. This is a good example. Yes, anyone else?
Am I right in thinking that I'm talking to Miss Martha?
Okay, so see, in this case, you can confirm, you can assume the name or ask the interlocutor during the preparation time, and you can obviously confirm The examples that you've shared with me are brilliant. I think they work well. So you can confirm after your introduction, you can confirm that I'm here to check up on Miss Martha's progress. Am I right in thinking that this is Miss Martha's house? So that would be good. Palak, do you want to say something?
No, ma'am.
Manpreet, you've raised
Yes,
your hand.
ma'am. Am I right thinking I am talking with the, Mrs. Martha? Is it?
Yeah, Mrs. only if the interlocutor says that call me Mrs. Right? Miss, Mrs., Mr. These are titles. Use them only if the interlocutor tells you to use them. Otherwise, first name basis is good enough. And what about the second scenario now? On the right-hand side, will you need to introduce yourself in this case? How will you start the role play? This is also a home visit.
Ma'am, no, will not introduce.
No, ma'am. No, ma'am. No need for
Because we already
introduction.
have
Middle of
assessed
the
the patient.
conversation, ma'am.
We can
Ma'am,
say,
it's a middle.
okay,
Middle of the
Hi.
conversation, ma'am. We don't have to introduce, no confirmation, nothing, ma'am.
Awesome, awesome.
Yes,
Yes.
ma'am. Yes,
Now, if
ma'am.
you read this carefully in the background information, you have just finished an assessment of the patient's needs. And this is from the OET website, right? We just discussed this, but this is a situation where the role play will begin from the middle of a consultation. So obviously, you don't need to introduce yourself. You don't need to ask the patient's name, or you don't need to confirm the patient's name. You can simply assume a name. How will we start a role play in this case? Can I get some examples? Please raise your hands if you'd like to answer. Yes, Tabdi.
All right. Now I have assessed your condition. So after that, ma'am, I'll start according to the point, according to the bullet point.
Okay. Madhu.
Martha, I have just finished the assessment of John, and I would like to tell you that his needs and care. We will talk about the care, his needs and care after. Sorry, ma'am.
That's right. You're doing well. Would you like to finish that?
Yes, ma'am. Martha, I have just finished the assessment of John, and I would like to tell you that he needs continuous oxygen and also monitoring. So, could you please tell me how have you been coping with his condition recently?
Yeah, okay. Matlab uske baad, after that, you can just obviously see what the bullet point is and then tailor the conversation accordingly. Vikrish, would you like to try?
Yes, Miss. So Jenny, I have just completed with the assessment, and now I would like to discuss about the management of the care management of your husband, please. Could we continue?
Lovely. That was good. And finally, Suman.
Thank you, ma'am. Ma'am, I'm going to start so John, as I assessed Olivia's condition, I would like to discuss her finding with you. Is that okay with you? So,
yeah.
Okay. Thank you for allowing me. So, John, I am afraid that according to my findings, I would like to tell you that Olivia required continuous monitoring and assistance.
Yeah,
I
yeah.
hope you understand that.
Good. I just needed the introduction, and you did quite well. So did Vikrish, and so did Madhu. I think the only problem, and I'm afraid I don't recall the student's name, the very first example that we discussed, it was beautiful. The only problem was that you did not use the spouse's name or the patient's name. So if you want to build up rapport with someone, it would be a good idea to use if you use their name during the conversation, right? Makes them feel that you are attentive, you're paying attention to them. So assume the name, which in this case all of you did wonderfully, and you've given brilliant examples. I don't even think I need to share an example, so you can start that. All right, Jenny, I've just examined John, and now I'd like to speak to you about care options for John while he's at home. May I proceed? So this is a good introduction. Great. Now let's come to another scenario. Again, read the one on the left-hand side and tell me, would you need to introduce yourself in this case? Are there any students who are taking the exam day after tomorrow? Can I get some answers from them?
Yes, yes, Miss.
Okay, Krish, okay, good to hear that you're taking the exam. And who else is taking the exam?
Yes, ma'am. I'm Shatabdi, ma'am. I'm also taking.
Lovely. So Shatabdi, what do you think? Would you need to introduce yourself in the role play on the left-hand side?
Yes, ma'am. I'll introduce myself, but for the patient name, I'll just confirm the patient's name.
Okay. Can I get an example?
Yes, ma'am. Just yes. I am Shatabdi. I am a duty nurse here today. Yes, your blood results already have come. So no, ma'am. Sorry, sorry, ma'am. Before that, I need to confirm the patient's name.
Yeah.
Actually, I forgot.
Start over. It's okay.
Okay. Good morning. I am Shatabdi. I am one of the duty nurse here today. Am I correct in thinking that I am talking to Mr. Brown? Okay. So I already have got your blood test results, which is showing that your sugar level is little high, and for that you have prescribed the medication. So how you are following the thing at home?
Okay. So the patient was already diagnosed with diabetes in the previous visit, right? I think,
yes, ma'am.
Yeah, we can use a more suitable sentence when you are establishing the agenda of the meeting, but otherwise you did well. Now, something just came to my mind. We are humans, and it's very, very natural to sometimes say the wrong thing or make a mistake when we're speaking. What if this happens in the role play? Should we start over? What do you think can be done? Like, for instance,
no, ma'am. No, ma'am. I'll just continue, because if I again go to the first, then again I'll make more mistakes like how I did right now.
So then what should have been done? Let's say you had to continue. You didn't have a choice to start over. What would you have said after you realized that you made a mistake?
So
yes, ma'am. So I'll just say, okay, Martha, like that. Again, in next sentence, I'll use her name because the patient is a follow-up patient. So
okay. Another suggestion, Stabdi, can be once you realize that like in your case, you forgot to ask the patient's name, right? You can verbalize this. And even in real life, if we make a mistake, we rectify that by verbalizing it, right? We say, I'm so sorry. I just missed asking or confirming your name. I need to do this as a part of our policy. Could you please confirm your first and last name? Wonderful. Thank you for doing that. How may I address you? So if you do something like this, when you acknowledge that, okay, you missed it first, but now you're rectifying this, this is a wonderful skill to have, isn't it? So even in the exam, if you make a mistake, it's better to verbalize it, acknowledge that you made a mistake, and believe me, you will not be penalized for that mistake then.
Yes.
Because you are humans, you can make mistakes as long as you acknowledge it and rectify it.
Yes, ma'am. Yeah, thank you so much, ma'am.
Okay, Madhu, what about you wanted to try the first one? First role play?
Yes, ma'am. Yes.
Go on.
Good evening, Martha.
Good evening.
Good to see you again.
Good to see you again as
well. Could you please tell me how have you been doing since our last visit?
Since our last visit. Lovely. Lovely. This is a good introduction. Krish, would you want to try as well?
Yes, Miss. So Jenny, I have going through your blood test, and it is very important to inform you that the blood sugar level has been rising. Oops. Ma'am, I'm out of track. I was just noting down something.
That's all right. Slight misunderstanding of the situation here. So like Madhu gave a great example, right? She assumed that she was the person who met the patient in the previous visit also. Let's say we assume that this is the first time you're meeting the patient, someone else attended to the patient the last time. In that case, what sort of introduction or how would we initiate the role play in this case? Can someone give it a try? Who is joining as iPhone guest? Please identify yourself, iPhone guest.
Ma'am, it's me, Anju.
Okay, Anju, would you like to try?
Actually, ma'am, this is my first session and I'm just learning all these things, ma'am.
Okay,
I'll
no.
try next time, ma'am.
Right. Madhu wants to try. Great, Madhu, go ahead.
Good evening.
Good evening.
I'm Madhu Kangra, one of the registered nurses in community setting. Am I talking to Martha?
Yes, you are.
So Martha, could you please tell me how have we been doing since the last visit?
See, okay, that is also good, Madhu, and you can also maybe use some information here, like if you're meeting for the first time to the patient, you can establish the agenda. Your introduction is also good. Another equally appropriate way can be that, so Martha, I have your notes here. I see that you're here for a follow-up today and that you were told that you were dealing with high sugar levels and we're going to check up on your progress today. Right? So that would be another way where you can document the information from the role play card.
Yes, sir.
Great. What about now we have a role play card for doctors. In this case, this is from the OET website. We've already discussed this. So will you need to introduce yourself? We've already discussed 2 ways, right? And I don't think we need to discuss this again. All right, now we have 2 settings from, these are from medicine, but even nurses and Shanza, if you're still in the class, you can also participate. We have 2 settings here. First one, doctor's clinic. This 64-year-old patient with type 2 diabetes is a regular patient of yours. You have just finished an examination of the patient's feet during which you identified an infection. First task is give findings of the examination and so and so. How will we start the role play in this case?
From examination part, I have just completed with your examination. On the basis of my examination, you are having an infection.
Start from the very beginning. How would you start?
Thanks for letting me examine you.
What about the patient's name? You can assume a name.
Thank you, John, for allowing me to assess yourself.
Thank you for allowing me to examine you, John. I finished my examination. I'd like to talk to you about my findings now. May I proceed? Okay, this can be a good way to start. Introduction. Yeah.
We can also say, ma'am, because it's a superficial ulcer, so we can say, ma'am, I'm glad to tell you that this is a superficial ulcer. So
glad, ma'am.
I will.
Sorry. Patient is diabetic.
I'm sorry.
Yeah, even otherwise, if I mean, see, as a health professional, you would feel differently about a diagnosis. As a patient, even if it's superficial, it might be a big deal for them and they would not be glad to hear that.
Yes.
I would avoid it. In fact, in your OET writing and speaking, what OET suggests is avoid subjective language. Subjective is where you have an opinion about something. So even
Yes,
if the patient is recovering, don't use words like fortunately. Be objective in your speech. And this is both for speaking and writing. But thank you for making me laugh. Okay, what about the second one? It's an aged care facility. So you're speaking to an 81-year-old patient. No, you're not speaking. This 81-year-old patient has hypertension and rheumatoid arthritis. The nursing unit manager has requested that you assess this patient because he or she has been experiencing problems when urinating. You are on-call doctor and you're going to speak to this patient for the first time. And then the first task is find out about the patient's symptoms. How will we start the role play?
Ma'am, introduce
I'm
ourselves.
introducing ourselves.
Let's practice this. Let's now practice this.
Introduce.
So how will we start? I'll take on the role of a patient. Please begin the role play.
Good evening.
Good evening.
I'm Madhu Kangara, one of the doctors in the aged care facility. Am I talking to Martha?
Yes.
All right, Martha. So I have your notes and I can see that you're having some problem while urinating. Is that right?
Yes, doctor, I've been having some problems when urinating.
Okay, so could you please tell me about your symptoms?
Okay, I think now this is 81-year-old patient, right? And remember what we discussed on the OET blog, that when you're speaking to an older patient, if you want to convey respect, maybe it's a good idea to check if they're comfortable with you calling them by their first name, right? So in this case, I would prefer, and this is a non-urgent setting, right? This is not an urgent situation. So in this case, I would like if you can check with the patient that, what do you prefer I call you? I think that would be nice here. Yes, Soman?
Yes, ma'am. I have a question, ma'am. Ma'am, in this case, when we are introducing ourselves to the patient and confirming the name to the of the patient, then is it a good idea, ma'am, that we are, telling the purpose of our visit so that patient get comfortable to discussing his or personal things with us? I mean, personal.
Exactly. That is the second thing I was coming to. Now, this is a very personal and intrusive area of the patient's life, right? When you're speaking about matters which people deem very personal and they are obviously not comfortable. I mean, I as a person would not be comfortable discussing these problems. I need to be first made comfortable. So what do we practice in these cases? Indirect language. And if you remember my class on information gathering, we also explain the rationale behind the line of questioning to put the patient at ease. So 3 things you must remember. Number 1, this is an elder patient. So as a sign of courtesy and respect, ask the patient whether or not they're okay with you addressing them by the first name. Number 2, because you're going to be talking about something that's extremely sensitive and somewhat intrusive, take their permission and explain that you're going to ask questions on that topic. Once they give you the consent, when you proceed, use indirect questions. I hope you know what indirect questions are. Anju, if you don't know it, you will do this in due time. Indirect question is where we soften the questions. Like, for example, if I have to ask a question about urinary incontinence, rather than asking, do you experience any urinary incontinence? I would soften this by adding a softener or a hedging phrase, something like, would you mind telling me if you've experienced any incontinence? Okay, so these are the 3 things here. Any questions about this?
No, ma'am.
No, ma'am.
How lovely. Then I would come maybe back to the screen and let you ask me your questions. There were some questions that I missed in the chat. We still have about 15 minutes. If you would like to ask any questions or give me ideas for the next class, I would be